Type 1 diabetes is a condition where the pancreas, which is located in the abdominal section of the body, doesn't make any insulin. There's damage to the pancreas from the immune system, and the patient can no longer make insulin.
Insulin is a hormone. It's secreted by pancreatic beta cells, and insulin is needed to mobilize glucose from the bloodstream into the peripheral cells so that it can be used for energy or for fuel. Patients need insulin to survive, and they'll need to be on insulin lifelong.
Type 1 diabetes used to be called juvenile diabetes because it was primarily something that happened in young people. And now we know that type 1 diabetes can have an onset even later in life.
I was diagnosed with type 1 diabetes at the age of 27, which is kind of unique because most people, when they think of type 1 diabetes, they think of children, adolescents being diagnosed with the condition.
Typically, adults with type 1 diabetes aren't overweight, they're not sedentary, and they don't look like a typical type 2 diabetic patient. It's not exactly fully understood as to what causes type 1 diabetes, but it appears to be due to a complex relationship between heritable factors, genes that you inherit, and environmental triggers. So you sort of need the perfect storm to develop type 1 diabetes.
The symptoms of type 1 can be rapid onset. So someone can go from feeling fine a few days ago to having full-blown symptoms of diabetes.
Well, a 4 to 6-year-old may present with bedwetting, reports of increased thirst. Parents might notice that they're using the bathroom more frequently. Similarly, you'll notice a teenager is just drinking a lot of fluids. They may be more fatigued than usual.
I was diagnosed with diabetes when I was 15 years old. I had lost a lot of weight, about 20 pounds in 2 or 3 weeks, and I was a very small girl to begin with, and I was just thirsty all the time and going to the bathroom all the time. I couldn't make it through a 30-minute television show without going to the bathroom.
There are two numbers that we're looking at. So one is the hemoglobin A1C. If your A1C is greater than or equal to 6.5%, then you are diabetic.
In the setting of classic symptoms related to high blood sugar, a random blood sugar that's over 200 makes the diagnosis of type 1 diabetes. A fasting blood sugar that's greater than 126 is also consistent with diagnosis.
There are a few ways to differentiate between type 1 and type 2 diabetes. First, we look at the age of the patient, although at any age you can have either type of diabetes. We look at the degree of the high blood sugar, and we think about that in the context of how quickly did they develop symptoms. And then we can actually check for their insulin levels. If someone has very low insulin production or no detectable insulin, that's going to go more along the lines of type 1 diabetes. We can check the blood for the antibodies that are made by the immune system that can actually be the culprits in attacking the pancreas in type 1 diabetes. And if those antibody levels are elevated, then we know that it's type 1.
Patients and families are initially shocked by the diagnosis. It's an overwhelming diagnosis. It's very life-altering. But I'm going to help them try to live as normal life as possible.